One of the main reasons to do a sleep study, which is represented here, is to look for sleep apnea. What is sleep apnea? Sleep apnea simply means not breathing, and it's not breathing at nighttime. Here is a patient who has sleep apnea, and the airflow going from the outside environment into the lungs has slowed down or stopped. So, if this is the back of the throat, and this is your tongue, the tongue falls against the back of the throat. Again, not to let air get from the outside environment into your lungs. Your brain recognizes this. Your brain then wakes you up, which is what's happening here. The patient is awake and starts to breathe normally again. Because the problem is not during wakefulness, the problem is during sleep. Then, as you can see, the flow changes again, and there's another episode of no flow. Who needs sleep studies? Well, if you're male, you're over 45, you have high blood pressure, you have witnessed apnea, in other words, somebody has seen you gasp or choke in the middle of the night while you sleep, if you have a large neck. These are some of the main reasons to have a sleep study. Most sleep patients who have apnea either present with being very tired during the day, and that can be measured with something called an Epworth Sleepiness Scale, or they have insomnia. So if you have any of those, you need a sleep study because you definitely have apnea. The only question is, how severe is the apnea? If the apnea is severe enough, we would be recommending treatment. The fundamental treatment for this is CPAP, which stands for Constant Positive Airway Pressure. Okay, so all it is a glorified fan that runs with a hose to a mask that goes over your nose and mouth and blows air at the back of your throat to puff your windpipe open so that the back of the throat does not close off with your tongue. It is non-invasive, it is relatively inexpensive, and it works wonderfully well. There are other options for treatment as well, and you can talk to the doctors at Sueño Center to find those out. Why do you want to treat it? Because treating sleep apnea will reduce your risk of heart disease, arrhythmia, hypertension, stroke, and diabetes.